Okay, so today's deep dive, it's taking us to the Himalayas.
Oh, wow.
Yeah, to the eastern Himalayas.
Oh, I've heard.
To Arunachal Pradesh.
Cool.
And we're going to be exploring the healthcare system there.
Interesting.
Yeah, and I think you might be surprised by some of the stuff that I found in these sources.
I'm always surprised by the stuff you find in the sources.
Well, this one's pretty interesting because it really shows how geography and healthcare are really intertwined in this region.
Yeah, that's something that we don't always think about, you know?
Yeah.
Like, when we think about healthcare, we just think of hospitals and doctors.
Right.
But in Arunachal Pradesh, the landscape itself is, like, a major factor.
Yeah. You know, I was reading this stuff and I was like, wait a minute. Really? Like, people have to travel for how long to see a doctor?
Yeah, it's pretty wild.
Yeah.
Some people have to travel for like 2 to 3 days to get to a hospital.
What? To get to, like, any kind of hospital?
Yeah, like just to reach a hospital.
Oh, my God.
Yeah. So, like, can you imagine trying to get emergency care when you're facing a journey like that?
No. I mean, that's, like, unfathomable.
Yeah.
And here I am getting annoyed if I have to wait, like an hour in a waiting room.
Right. It really puts things in perspective, doesn't it?
It does, yeah.
So, yeah, Arunachal Pradesh is incredibly mountainous,
Right.
which makes building and maintaining roads and other infrastructure
Oh, yeah.
like really challenging. And that obviously has a huge impact on the healthcare system.
So how is the government even attempting to provide health care in such a challenging environment?
So they've implemented what's called a 3-tier healthcare system.
Okay, a 3-tier?
Yeah.
Okay, so break that down for me.
Okay, so think of it like a pyramid.
Okay, I like visuals, so a pyramid works.
All right, so at the very top, you have what's called tertiary care.
Tertiary care.
Yes, and this is for the most serious and complex medical cases.
Okay, got it.
The Tomo Riba Institute of Health and Medical Sciences,
Oh, my God.
or TIIHMS for short.
Okay, TIIHMS.
TRHMS is the main facility for tertiary care. It's located in Naharlagun,
Okay.
and it's actually the state's first medical college and their largest hospital.
So if you need specialized care, that's where you would go.
Exactly.
But what about everyday health care needs? Like
Yeah.
if you have the flu or you just need like a regular checkup.
Yeah, so that's where those other tiers come in.
Okay.
The second tier consists of district and community health centers,
Uh-huh.
or CHCs.
CHCs, okay.
Yeah, and these are located in towns and are meant to provide more routine care.
Got it. So they're kind of like the in-between
Exactly.
between like basic care and then the specialized stuff you'd find at TRHMS.
Yeah, exactly.
Because you said these are located in towns.
Yes.
And we know that most people in Arunachal Pradesh live in pretty remote areas.
Yes, exactly. And that's where things get even more complicated.
Okay, I was going to say,
Yeah.
how do they get care?
So the third tier of the system is made up of primary health centers,
Okay.
or PHCs,
All right.
and even smaller subcenters. So these are the front lines of healthcare for those remote villages.
Right.
But access remains a major, major issue.
Because we're talking about mountainous terrain, limited roads, and I'm assuming transportation options are pretty scarce as well.
You are spot on. Yeah. Reaching these PHCs can often require walking for hours, if not days.
Oh, my gosh.
And that delay can be life-threatening in emergency situations.
Right.
But it's not like the government is ignoring the problem. They've actually launched a number of initiatives to try to improve access to healthcare.
Okay, tell me more. Are we talking helicopters? Because honestly, that's what I'm picturing at this point. Like airlifting people to hospitals.
Helicopters would certainly be helpful.
Yeah.
But one of the most impactful initiatives is the Arunachal Yojana, or CMAAY.
CMAAY, okay.
And this program provides free healthcare coverage for tertiary care, including treatment at private hospitals.
So if someone needs to travel to TIHMS or even a hospital in another state, they don't have to worry about the cost.
Exactly. It's a huge step towards making healthcare more equitable.
Right.
But it doesn't address the issue of actually getting to those hospitals.
Right, because even with free health care, if you can't physically reach a doctor, it doesn't help much.
Right.
So what are they doing about that?
That's where technology comes in.
Okay.
They're investing heavily in telemedicine and digital health initiatives.
Yeah.
They've implemented a platform called
AIinHealthcare,
which allows people to have virtual consultations with specialists.
So that's like telehealth, right? Where you can
Yeah.
basically video chat with a doctor?
Exactly. It's been a game changer for people in remote villages.
Oh, wow.
They can get expert advice and diagnoses without needing to undertake those incredibly difficult journeys.
Yeah, that's amazing.
Yeah,
It sounds like they're really trying to leverage technology to bridge the gap in access.
they are.
Wow.
And they're even experimenting with things like AI-driven diagnostics
Really?
in those PHCs we were talking about. So even if a specialist isn't physically present, these systems can analyze blood work, x-rays, and other data to help make diagnoses.
Wow. So they're combining like high-tech solutions
Yeah,
with those on-the-ground efforts. It sounds like a pretty innovative approach.
it is.
Yeah.
And it's not just limited to technology. They also have mobile medical units
Okay.
that travel to remote villages, providing basic care and essential medications.
Right.
And here's where it gets really interesting. They're also integrating traditional medicine with AIIHH centers.
AYUSH. Okay, I have no idea what that is. Break it down for me.
Okay, sure. Yeah.
So AYUSH stands for Ayurveda, Yoga, Unani, Siddha, and Homeopathy.
Oh, wow.
Yeah.
Okay.
So these are traditional systems of medicine that have been practiced in India for centuries.
Right.
And now they're being incorporated into the formal healthcare system in Arunachal Pradesh.
Okay, so that's bringing in the expertise of local healers and traditional practices.
You got it.
They're training local healthcare workers in these traditional methods and setting up AYUSH centers where people can access these therapies.
Yeah.
It's really a fascinating blend of ancient wisdom and modern medicine.
It makes you wonder what we might learn from these traditional practices.
Yeah.
I mean, if they've been around for centuries, there must be something to them, right?
Absolutely. And there's a growing body of research exploring the efficacy of these traditional systems.
Right.
It's an area ripe for further exploration.
Yeah.
And who knows, maybe some of these ancient practices hold the key to solving modern healthcare challenges.
Well, that's a thought-provoking idea, but let's get back to the initiatives the government is focusing on. You mentioned maternal and child health.
Yes, that's a huge area of focus. They've implemented programs like the Janani Suraksha Yojana,
Okay.
or JSY,
JSY, right?
and Janani Shishu Suraksha Karyakram, or JSSK,
Okay.
which aim to reduce maternal and infant mortality rates.
Wait, can you clarify what those programs do? The names are a mouthful.
Of course. So JSY provides financial assistance to encourage pregnant women,
Okay.
particularly in rural areas,
Okay.
to give birth in hospitals rather than at home.
Well,
JSSK goes a step further, ensuring that both mothers and newborns receive free and comprehensive care during and after childbirth.
so they're removing the financial barrier and making it easier for women to access safe childbirth services. That's huge.
It is.
Yeah.
They're also conducting regular immunization drives in remote villages to protect children from preventable diseases.
Okay.
And they're part of the national mission Indradhanush, which aims to vaccinate all children and pregnant women.
It sounds like they're really pulling out all the stops to improve healthcare in Arunachal Pradesh. And I can see how these programs are crucial given the unique challenges they're facing. But let's be honest, there must still be significant hurdles.
There are, in fact, we've only just scratched the surface.
Yeah.
Yeah, we've talked about like the incredible distances
Right.
people have to travel for care,
Uh-huh.
but that's just one piece of the puzzle. The shortage of medical professionals is another massive challenge.
Yeah, that makes sense. I mean, it's a beautiful place, but I imagine it's hard to attract doctors and nurses to such remote areas,
Yeah.
especially when they could be earning more in bigger cities.
Exactly. And it's not just about the salary.
Right.
Think about it. Like if you're a doctor who specializes in, say, cardiology,
Yeah.
and you're offered a position in a state-of-the-art hospital with all the latest equipment
Right.
versus a small, under-resourced clinic in a remote village,
Yeah.
which one would you choose?
I mean, the choice is pretty clear, especially if you're ambitious and want to be at the forefront of your field.
Right.
But that creates a real dilemma for Arunachal Pradesh, doesn't it?
Yeah.
They need more specialists,
Uh-huh.
but it's tough to attract them without having the facilities and resources that those specialists expect.
It's a classic chicken and egg situation.
Totally, yeah.
And to make matters worse, Arunachal Pradesh currently lacks specialized hospitals
Okay.
for things like cancer treatment, cardiology, and neurology.
So even if they could attract those specialists,
Right.
they don't have the facilities for them to work in.
Exactly.
So what happens if someone needs that kind of specialized care?
They have no choice but to travel to hospitals in Assam or Meghalaya,
Oh, wow.
which adds another layer of difficulty and expense to an already challenging situation.
Yeah, imagine having to travel for days potentially while you're already sick just to get the care you need.
Right.
It's heartbreaking to think about. It sounds like they desperately need more investment in medical facilities and infrastructure, but that takes time and resources. And in the
Yep.
meantime, people still need care.
Absolutely. And that's where some of those innovative approaches we talked about earlier come into play.
Okay.
Like, for example, those AI-powered diagnostic systems
Right.
have the potential to bridge the gap in specialist care.
Okay, how so?
So imagine a small clinic in a remote village,
Yeah.
they might not have a cardiologist on staff, but they could have an AI system that can analyze an electrocardiogram or EKG
Right.
with a high degree of accuracy.
So even without a specialist physically present, they can still get a preliminary diagnosis and potentially start treatment sooner.
Exactly. It's not a perfect solution,
Right.
but it can buy valuable time
Yeah.
and help stabilize a patient until they can reach a specialist if needed.
It's like having a virtual specialist on call 24/7. That's amazing.
Right.
But it still requires getting people to those clinics in the first place.
Yeah.
We're back to that issue of transportation.
You're right. Access remains a huge hurdle.
Yeah.
But remember those mobile medical units we discussed?
Yeah.
They're literally bringing healthcare to the people's doorsteps.
Right.
And with the potential to equip them with these AI-powered diagnostic tools,
Yeah.
their impact could be even greater.
Okay, now I'm starting to see how all these pieces fit together. You've got the government initiatives, the focus on technology, and these efforts to reach people in remote areas. It's like a multi-pronged approach.
Right.
But we haven't really talked about the role of the private sector. Is there potential for them to contribute?
There is, and this is where things get really interesting.
Oh, here's where it gets really interesting. I love it when you say that. Okay, tell me more. How can the private sector help?
Well, we have to acknowledge the reality.
Okay.
The private sector has been hesitant to invest in healthcare in Arunachal Pradesh.
Right.
And the reasons are understandable. Low population density, challenging terrain, and the perception that it's not a profitable venture.
Yeah, I get it. So how do you convince them to come on board?
So it's going to require some creative thinking
Right.
and a willingness to collaborate.
Okay.
The government could offer incentives like tax breaks or subsidies to make it more financially attractive
Right.
for private hospitals and clinics to set up operations in the region.
That makes sense. But even with those incentives, wouldn't they still face the same challenges of access and low patient volume?
They would,
Yeah.
which is why public-private partnerships or PPPs are being touted as a potential game changer.
PPPs, remind me what those are again.
Okay, so think of it as a collaboration where the government and private companies pool their resources and expertise. So for instance, a private hospital chain could partner with the government to run a district hospital, sharing the costs and responsibilities. Or a telemedicine startup could collaborate with the government to expand access to virtual consultations in remote areas.
So the government provides some infrastructure and funding.
Right.
And the private companies bring their expertise and resources to the table.
Exactly. And the potential applications are vast.
Okay.
We could see PPPs focused on developing affordable pharmaceuticals, establishing training programs for local healthcare workers,
Right.
or even creating innovative health insurance schemes tailored to the needs of rural communities.
It sounds like PPPs could be the key to unlocking progress in healthcare in Arunachal Pradesh. But you mentioned earlier that there are a lot of moving parts. What are some of the key challenges they would need to address to make these partnerships successful?
You're right. It's not just about signing agreements.
Right.
First and foremost, there needs to be a strong commitment from both the government and the private sector.
Right.
They have to be on the same page in terms of goals, expectations, and a willingness to be flexible and adapt as they go.
So it's about building trust and a shared vision. What else is crucial?
A clear regulatory framework is essential.
Okay.
So the roles and responsibilities of each party need to be clearly defined. And there needs to be a transparent process for resolving disputes or disagreements.
Right. You don't want these partnerships to get bogged down in bureaucracy or misunderstandings.
Exactly.
That's a good point. Clear communication and transparency are vital.
Absolutely. And of course, funding is always a major consideration.
Right.
These PPPs need a sustainable funding model that ensures their long-term viability.
So it's not just about providing seed money, it's about creating a system where these partnerships can thrive over time.
Exactly. And that requires careful planning, realistic budgeting, and a willingness to be innovative in securing funding from diverse sources.
Right.
They might explore options like impact investing, where private investors are attracted to projects that generate both social and financial returns.
It sounds like making these PPPs work requires striking a delicate balance.
Yeah.
You need the government's support and commitment, the private sector's expertise and resources, and a funding model that can sustain these initiatives over the long haul.
You've hit the nail on the head.
Okay.
But if they can get it right, the benefits could be transformative, not just for the people of Arunachal Pradesh, but potentially for other regions around the world facing similar healthcare challenges.
It's inspiring to see how people are tackling these complex issues head on.
Mm-hmm.
It makes you realize that even in the face of seemingly insurmountable obstacles, there's always room for innovation and progress.
Absolutely. And it's a reminder that healthcare is not just about hospitals and technology. It's about people. It's about ensuring that everyone, regardless of where they live or their circumstances, has the opportunity to live a healthy and fulfilling life.
Okay, I'm totally with you there. But I have to ask, we've talked about the potential of these PPPs, but have there been any real-world examples of them actually working in Arunachal Pradesh? Are there any success stories we can point to?
That's a great question, and you're right to ask for concrete examples.
Yeah.
There have been some promising pilot projects, particularly in the area of telemedicine, that suggest PPPs can work in this context.
Okay, give me the details. Tell me about a project that's actually making a difference.
Okay, well, there's one initiative that stands out.
Okay.
It involves a partnership between the state government and a private telemedicine company.
Right.
They've set up a network of virtual consultation hubs in remote villages.
Oh, wow.
Equipped with basic diagnostic tools and high-speed internet connectivity.
So villagers can walk to these hubs and essentially have a video call with a doctor.
Exactly. And because these hubs are connected to a network of specialists in various fields, patients can access a wide range of expertise without having to travel for days.
So it's like bringing the specialist to the village virtually. What kind of impact has this program had?
It's still relatively new, but the early results are encouraging. They've seen a significant increase in the number of people seeking medical care, particularly for preventative services like checkups and screenings, which were previously neglected due to the difficulty of travel.
That makes sense. If it's easier and more convenient to access healthcare, people are more likely to take advantage of it.
Exactly. They've also seen a reduction in the number of referrals to hospitals in other states for specialized care.
Really?
Because the virtual consultations allow specialists to assess patients remotely. They can often provide treatment plans or manage conditions without requiring the patient to travel.
So it's not only improving access to care, it's also potentially reducing healthcare costs by avoiding unnecessary travel and hospital stays.
Precisely. And what's really interesting is that this program has also created employment opportunities for local youth who are trained to operate the telemedicine equipment and assist patients during their consultation.
Wow, so it's a win-win-win situation.
Yeah.
Improved access to care, potential cost savings, and even job creation in rural communities.
It's a great example of how PPPs can leverage the strengths of both the public and private sectors to create a positive impact.
Okay, I'm convinced PPPs have the potential to be a game changer in Arunachal Pradesh. But we've focused a lot on technology-driven solutions. What about those traditional medicine practices we talked about earlier? Where do they fit into this whole picture?
That's an excellent question.
Yeah.
And it's something that's being actively explored in Arunachal Pradesh.
Okay.
Remember those AIUSH centers we mentioned?
Yes.
Well, they're not just about offering traditional therapies. They're also becoming hubs for research and knowledge sharing.
I'm intrigued. Tell me more.
Okay, so there's a growing movement to integrate traditional medicine practices with modern healthcare, not just in Arunachal Pradesh, but globally.
Right.
And PPPs can play a role in this as well.
Okay.
Imagine private pharmaceutical companies collaborating with traditional healers to study the medicinal properties of local plants and herbs.
So you could have modern science validating and potentially even enhancing traditional remedies.
Exactly. Or you could have private hospitals partnering with AIUSH centers to offer integrated healthcare programs. Combining the best of both worlds.
It's fascinating to think about the possibilities. We often view traditional and modern medicine as separate entities. But what if they could complement and enhance each other?
And that's the question being asked in Arunachal Pradesh. And the answers they find could have implications for healthcare far beyond the borders of this one state.
Okay, my mind is officially blown. I love how this deep dive has taken us from the challenges of geography and infrastructure to the potential of technology and the wisdom of traditional medicine. It's been quite a journey.
It has, and it highlights the fact that healthcare is not a one-size-fits-all solution. It requires a nuanced understanding of local contexts, a willingness to embrace innovation, and a commitment to collaboration.
Well said, but we've covered so much ground. I'm wondering if you can distill it down for our listener.
Okay.
If they were to take away just a few key points from this deep dive, what would they be?
I think the biggest takeaway is that healthcare is deeply personal, you know?
Right.
We often get caught up in the big picture, like policies, statistics, technology.
Right.
But at its core, healthcare is about people's lives, their well-being, their families.
Yeah, it's so easy to forget that, isn't it?
Yeah.
Especially when we're talking about systems and challenges on such a large scale.
Exactly.
Right.
So for your listener, maybe the takeaway is to connect with that human element. Like imagine yourself living in a remote village in Arunachal Pradesh, facing those challenges of accessing healthcare.
Yeah, it really makes you stop and think, what would I do in that situation? How would I get the care I needed?
Exactly. It fosters empathy and understanding. And from there, we can start asking those bigger questions about how we can create a more just and equitable healthcare system for everyone.
Okay. I'm with you on that, but I'm also thinking about our listener who might be feeling a little overwhelmed right now. We've covered a lot of ground.
Yeah.
Some of it pretty heavy stuff.
Right.
What's a more hopeful takeaway they can hold on to?
You're right. It's important to balance the challenges with the potential for positive change. So I'd say another key takeaway is the power of innovation.
Okay.
What's happening in Arunachal Pradesh with the telemedicine initiatives, the integration of traditional medicine, and the exploration of PPPs is incredibly inspiring.
Yeah, it shows that even in the face of daunting obstacles, people are finding creative solutions.
Absolutely. And those solutions could have ripple effects far beyond Arunachal Pradesh.
Right.
Think about the potential of AI-powered diagnostics to improve healthcare access in underserved communities around the world.
Wow.
Or the insights we might gain from traditional healing practices that could lead to new treatments and approaches.
So it's not just about solving problems in one region. It's about potentially transforming healthcare on a global scale.
Exactly. It's about recognizing that challenges can be catalysts for innovation and that those innovations can benefit us all.
Okay, that's a hopeful note to end on. But before we wrap up, I have one more question for you.
Okay.
And it's something I've been pondering throughout this entire deep dive.
Okay.
We've talked about all these efforts to improve healthcare access. But what about prevention?
Oh.
It seems like a lot of the challenges we've discussed stem from, a lack of basic healthcare infrastructure and preventative care.
That's a really important point. And you're right, prevention is often neglected, especially in resource-constrained settings.
Right.
But it's crucial. Imagine if those remote villages had access to clean water and sanitation, nutritious food, and education about basic hygiene and health practices.
It would fundamentally change the health landscape, wouldn't it?
Absolutely. It would reduce the incidence of preventable diseases, improve overall health outcomes, and ultimately lessen the burden on the healthcare system.
So investing in prevention is not just about addressing immediate needs. It's about building a healthier future for generations to come. It's about shifting the focus from reactive care to proactive well-being.
Precisely. And that requires a long-term vision, a commitment to community engagement, and a recognition that healthcare is not just the absence of disease. It's the presence of well-being.
Well said. It's been a fascinating and thought-provoking deep dive.
It has.
We've explored the complexities of healthcare in Arunachal Pradesh, from the geographical challenges to the innovative solutions being implemented. We've talked about the potential of technology, the wisdom of traditional medicine, the importance of public-private partnerships, and the crucial role of prevention.
And throughout it all, we've emphasized the human element, the people whose lives are directly impacted by the state of healthcare in this region.
So to our listener, we leave you with this as you go about your day. Consider the interconnectedness of our world. The challenges faced by people in Arunachal Pradesh may seem distant, but they offer valuable lessons for us all anyway. They remind us that healthcare is a global issue that requires local solutions, innovative thinking, and a shared commitment to creating a healthier world for everyone.
And who knows, maybe some of the solutions being explored in the remote villages of the Himalayas will one day inspire positive change in your own community. Until our next deep dive.
Yes.
Keep exploring.
Keep questioning.
And keep advocating for a more equitable and accessible healthcare system for all.